I am at the San Francisco International Airport heading to Sierra Leone to co-host the first International West Africa Symposium and workshops on infectious diseases.
That is the Dr. Bailor Barrie, Bailor as we've come to know him, heading off to Sierra Leone as the instigator and co-organizer of the most ambitious event planned with his collaborators at the Quantitative Biosciences Institute at the University of California, San Francisco, the University of Sierra Leone, and the Ministry of Health of Sierra Leone. Nevan Krogan, the director of QBI, and I met Bailor back in 2019 when he was introduced to us by the late Paul Farmer, who played a key role in establishing Partners in Health around the world. Through a series of meetings and events, we were inspired to work with Bailor on his vision of enhancing research and the overall delivery of health to Sierra Leone. But who is Bailor Barrie, and why Sierra Leone?
Ladies and gentlemen, will be landing shortly. Please fasten.
Just landed in Sierra Leone, so tired, can't wait to get home. I'm gonna walk through the airport and then take the boat to my house.
I'm Jacqueline Fabius, the Chief Operating Officer for QBI and a co-organizer of the first International West Africa Symposium and workshops on infectious disease, and I'll be guiding us through this story, and by the end of it, hopefully we'll understand why people 11,066 kilometers apart decide to plan a scientific event spanning over 1 week together.
I am Dr. Mohamed Barrie. I'm a Sierra Leonean physician. I studied medicine in Sierra Leone, and as a young child, I wanted to become a doctor, and I was even playing doctor when I was young. I would build my hospital, and the kids in the neighborhood would bring their dolls for me to treat them.
Bailor told me his story and told me about how complex it was to become a doctor. Coming from a humble background, studying hard, traveling far without transportation, and more which would be inconceivable to someone in the United States.
And I had to handwrite textbooks so that I can have something to read at night. So I will borrow textbooks from my friends who can afford them and handwrite them.
And eventually finding scholarships.
Some calls, and then I got Stephen Kahn from the Abundance Foundation to support my second year. So that's how I got to Harvard.
He is a man of tenacity. He eventually made it and applied for a PhD at several universities.
I wanted to do a PhD in global health, basically. So I applied to several universities.
And thanks to a suggestion from his partner Dan Kelly, with whom he started the Wellbody clinic in the early 2000s, he came to study at UCSF, which is how our paths finally cross in 2019.
Dan convinced me to come to UCSF.
Hey, Bailor, how you doing, buddy?
Nevan, how are you?
Nice to see you.
How's everything?
Good. You want to come and sit down and talk?
Yeah.
You're looking good, Bailor.
Really?
Yes.
Paul Farmer had introduced Bailor to us.
And he was like, hey, there is a guy that I know, Nevan. He's doing good, amazing work. I'll introduce you. So he sent an email.
That's right. And then you came and we hugged.
Yeah.
I don't know if I think we hugged. No, we didn't hug the first time.
Yeah, no. When I first came, I emailed you. And
I think it was the third meeting we hugged, and then we can't stop hugging now.
I know.
Nevan Krogan, the director of QBI, and I were going to both West and East Africa that year for various meetings and teaching a grant writing and scientific presentation
2018?
workshop in Uganda.
2018.
And then we visited you in 2019, in July.
Yeah.
And that is how we ended up stopping in Sierra Leone.
I think you were going to Africa and Nigeria
In Ghana, yeah.
and
And
Ghana
Uganda.
and Uganda.
Somehow,
and then you
Bailor
said,
infected us with his enthusiasm and endless pursuit of progress, learning, and a focus on the capacity building of his nation, Sierra Leone.
"Can we swing by?"
And we started talking about putting together a symposium.
Like, sure.
It was a pie-in-the-sky idea at first.
And it would be very important for Africa because it's like having for Sierra Leone it would be a huge benefit by having all the scientists in Sierra Leone and building relationships.
Showcase what you have set up there.
Yeah.
And, I mean, in my mind, this is what we should be doing.
5 years ago, in 2019, this was just a concept. We originally planned to do this in 2020, but the pandemic and later the national elections in Sierra Leone had us postpone it over and over. Now it is a reality, and Nevan, Bailor, and I are excited about this. The concept developed from a 2-day symposium with a poster session to a full 1-week event including capacity building workshops and a site visit to the clinic in Kono.
What are the numbers?
Something like 37 or 40 applicants for grant writing, and then just a lot of applicants from across Africa and Sierra Leone. There are 4 workshops being offered after the 2 days of science talks: clinical research and study design, grant writing and scientific presentation, molecular biology and cloning, and microbial sequencing bioinformatics. Each of these workshops is soup to nuts and is going to go deep to teach the participants how to do something crucial in research or obtaining funding for research.
But my goal for Sierra Leoneans is to understand so they can develop their own research and partner with people in the global north to do this research. Because, we cannot avoid the global north because that's where the resources are. But at least for people in Africa to do their ideas, their research ideas, to be developed from their own ideas.
Well, the world's getting so much smaller.
Yeah, so
with technology and with AI.
Yeah.
So, these are very important activities for us to be involved in.
No, AI.
And focusing on areas of the world where infectious disease is much more problematic.
So in fact, as I was saying, infectious diseases are mostly prevalent in Africa, but most of the questions or whatever are coming from here.
Right.
And for me, I think the question should come from Africa. Should come from where the infectious disease, and then scientists here or whatever can help in the design and other stuff. But the questions should basically come from where the problem is.
I agree. The question should be formulated in a collaborative manner with the place where the infectious disease are most prevalent.
Yeah. Absolutely.
That's what we're going to do, Barrie. And this will be this is a great meeting, one of our biggest meetings we've ever had. We've had them around the world, right?
Yeah,
this is one of the bigger ones. This is probably the biggest one.
It is the biggest one, yeah.
And it'll be...
It's happening in Africa.
And it's happening in Africa and Sierra Leone.
Yeah, and the government will be really excited about this, and I can sense from... I talked to the deputy minister, the CMOs, and they're all excited about this.
I asked Nevan to tell us a bit more about what motivated QBI to plan an event like this, and also share with us why, in his mind, this would be so important.
I'm Nevan Krogan, professor and director of the Quantitative Biosciences Institute in the School of Pharmacy at the University of California, San Francisco.
After all, being in California, some 11,066 kilometers and many time zones away, it is not an obvious idea. So I guess the question is, what's in it for the non-Sierra Leoneans?
The value of connecting scientists from around the world is that in different parts of the world, scientists view problems in different ways. They think differently about the problems. And they have different approaches, they have different technologies. And I think when you can get people together that think differently, have different tools to try to solve the same problem, this is where big breakthroughs can come. So bringing people together from different parts of the world to work together on important medical issues and scientific problems, I think is a very powerful way to make a progress to understanding disease and ultimately treat it.
Nevan went on to explain different places that QBI has had a joint symposium with and the benefits of working with people from different places.
In Berlin, in Germany. And I would say that conceptually, it's quite similar, the way we approach problems here in the United States and in California, and how it's done in Germany. In China, it's very different. Most of the scientists in China trained in China. They're closer to a lot of different infectious diseases. It's more prevalent there in Asia, so they have a different perspective, very powerful because of the different angles that each place has. So definitely in Africa and studying infectious diseases, it's much more prevalent there. HIV, tuberculosis. We study TB here. I've never met anybody who had tuberculosis here in the United States, and it's very prevalent in Africa and in West Africa. And we study Ebola here. Again, I don't know anybody who's had Ebola, so they bring something very unique to the table. They don't have the infrastructure we have here, but they do have access to samples from individuals that are infected with these different diseases. I think that represents a very grand collaboration, but I think the goal is to not just take samples and bring them back to California, it's to build up infrastructure there so that we can collaborate in a way where they're more in control of the research. So I think we're really dedicated to a long-term relationship with different countries, especially Sierra Leone, to build up infrastructure where different infectious agents can be effectively studied.
It was one thing to think of a symposium in a one-week event in concept, but did the Ministry of Health also share the same desire to have such an event? What are the needs in Sierra Leone, and does this event meet their needs? We spoke to Dr. Charles Senessie, Deputy Minister of Health.
I'm Professor Dr. Charles Senessie, Associate Professor. I'm the Deputy Minister of One in the Ministry of Health, Government of Sierra Leone.
It would seem crucial to fall in line with the needs identified by the Ministry of Health then. We probed further to identify both the needs and the readiness for the ambitious program that was beginning to form for the end of July 2024 in Freetown.
We need a lot of human resource capacity development, and then we are going digital in that to make sure that we geomark all the facilities with all the essential human resource for health that is there. And then the other factor will be now the drug delivery. And then, of course, the laboratory capabilities or the diagnostic capabilities. In fact, we have upgraded most of the health facilities, the health centers, to include an X-ray, to include an operating theater, to include laboratory capabilities.
For all intents and purposes, it seems we were all aligned. And gratefully, Bailor got the Ministry of Health on board as an organizing leader for the event. Dr. Senessie continued to outline not only what plagues African countries at this time.
Indeed, these infectious diseases is what is plaguing the countries, the low and middle income countries, including sub-Saharan Africa and not leaving out Sierra Leone. It's a great challenge that we on the Africa continent needs to get right.
But also the ministry's goals.
My goal is really to expand research, because when you stand on evidence, you can actually deliver healthcare on a more sustainable basis if you know where you are in terms of the data. Bringing the data to action. So which is why as a ministry we are really supporting and promoting and doing anything in the area of research, especially implementation and research. So I'm very much focused on infectious disease research and also other areas that support health.
We also spoke to Dr. Mustapha Kabba, the Deputy Chief Medical Officer for Clinical Services at the Ministry of Health, who's also a speaker at the symposium.
I'm Dr. Mustapha Kabba. I'm the Deputy Chief Medical Officer for Clinical Services in the Ministry of Health, Sierra Leone.
First, Dr. Kabba addressed the importance of Bailor Barrie being a key organizer of the symposium, workshops, and site visit.
Because he is an indigene of this country, he understands the issues, and he was able to articulate between the government side as well as from the partners to really understand these needs.
And then he talked to me about the context and the relevance and importance of bringing such an event to Sierra Leone.
How I see science in Sierra Leone is, at the moment, it's at its stage where it's at a crossroad. We have a medical school that's it's been around for more than 30 years, and a lot of us, even me, went through it. and we've created a good cohort of doctors, even professors, who are looking at how do you incorporate these sciences in the form of research to acquire data and also use this data to inform policy and structures that can improve our health sector. We are using a technology to help us identify, intervene, as well as prevent treatable causes of maternal mortality. So this is one way science, for example, will be influencing the lives of Sierra Leoneans, but it's at a crossroad.
I also asked him if he could elaborate on the role of research in West Africa. The rest of the world does not think about West Africa, perhaps Africa as a whole, as leading in research. Is that changing?
Well, what I think of the role of research in West Africa is that it has a very big role, especially in terms of understanding the disease entities and helping us to establish best practices. When I came back from Germany, I was really astonished to find that the amount of surgical site infections we also had in Germany were high, right? Even though things were so sterile, everything was good. But when you come here, you look at some of the places where surgeries are done, and you expect that the amount of surgical site infection should be so high that even people cannot survive. But that's not the case. People are surviving. Surgical site infections exist, but people are surviving and going through them in a very remarkable way. So some of these things need to be looked into. And even to have basic data on the prevalence of some of the illnesses we have in our country, right, will be a starting point where research can help in West African countries. Research can also help us look at drug applications, the drugs we use. West Africa is a virgin ground. There's a lot of things that have not yet been researched, and Sierra Leone being at the top of it, we really can, if we go with research, I think it will be the best thing that can happen in our health sector.
Okay. We had a firm hold on what the role of research was and what needs to be looked into. But what about the benefits of such an event? Who or what stands to gain from so many people arriving to virgin ground, as he puts it, to discuss science?
The benefits this conference will have on our country is huge, right? It's huge, and it can be viewed from different angles. You can look at the benefits of having technical dialogue, discussions around the barriers of people not being able to conduct proper research in a setting like Sierra Leone. What are those barriers? How can we address this issue? How can we work together?
I probed further with Bailor to ask for his thoughts. How would others see this?
I would say majority of the people on the street are thinking about how to survive the day. And so having the research and thinking about the food insecurity, thinking about like how infectious diseases can impact the livelihood of people would be an interesting thing to explore.
For the very average person on the street, however, a student and a policeman Bailor spoke to, they had more succinct thoughts about why bringing such a scientific symposium would be good for citizens. First, Bailor asked them about their thoughts on the recent COVID-19 pandemic and eventually led into science. First, we meet Marima, a student at a local cafe.
My name is Marima Ellenville.
So how familiar are you with COVID-19?
Well, I never say COVID-19.
I know COVID-19 is a dangerous illness. It came last year and claimed the life of many people in the world.
Do you feel the community gets a good grasp of what they cause infectious disease? The community know what they cause are?
Well, actually, some of them know, some of them don't know. So, some of them are the dirty environment where they live, and the people in back, they make the environment dirty. So you see.
Do you think say this country will benefit from getting more scientific knowledge in all sectors?
Yeah, I believe that.
Why?
Because if we work towards that and employ more people but this COVID-19 and go be stopped if we get good doctors them and good science people them. Well, that go be better. So sickness not go be boku.
If we have knowledge about science, it'll be good.
if we get,
It will help us
knowledge
know
about
about diseases
science,
and will reduce
fine.
disease. We then run into a local policeman, Hassan.
Mina Hassan Omar Samuel. Mina a police officer.
Do you feel saying community get a good grasp of how to prevent infectious disease?
I know we say 100%.
The area where I
because the
live,
people
I will
them
not say 100%,
na one
but
kind.
people have the knowledge on how to prevent infectious disease.
Do you think the country will benefit from having a scientific? Do you think that the country will develop for get a scientific knowledge in all sectors?
If we get
It will be great to have
it
scientific
will be-
knowledge
it
in
will
all
be great.
sectors.
Yes, not sure.
It would seem that from our small sample, people agree that scientific exposure would be a good thing for the country to have. Dr. Kabba also had thoughts about how the symposium would affect the average person on the street. And from his standpoint, bringing a scientific symposium to Sierra Leone would not only inform science, but have greater benefits at large as well.
It also helps in the area of hospitality. How can people understand the Sierra Leonean context? Because beyond conferences, there's a lot of social activity going on. People getting to know each other. People going out to see the tourist sites in our country, our beautiful country, seeing things that maybe they were never able, who could not understand from their perspective where they are, except to come here. So, and it also gives that opportunity for tourism to thrive. People make connections with the country whenever you travel to them. So the benefits are huge, enormous, from being a technical benefit, which I think we'll achieve, to the social aspect of it, as well as the personal relationships that are created through all of this.
The one-week event that will be taking place in Sierra Leone will have a 2-day symposium, which is how the scientific community refers to a conference. Scientists will be presenting their discoveries on infectious diseases and sharing knowledge. The scientists will be coming from the United States, Europe, Asia, and across Africa. The 2-day conference will be followed by 5 days of workshops, which we'll come back to later. Importantly, the week also includes a site visit to Kono for the visiting foreigners. In Kono, they'll be visiting the Wellbody clinic currently run by Partners in Health. The idea is to bridge the gap between lab work, discovery research, if you will, and the needs and outcomes at the clinic level. The Wellbody clinic is unique because it was at the forefront of the HIV pandemic and as such was also a key player when there was an Ebola outbreak in 2014. The clinic was an Ebola treatment center where they treated patients who didn't have Ebola and screened incoming patients for Ebola and sent them at the Ebola treatment center.
The clinic actually was started to support the amputated civilians of the civil war, of the 10-year civil war in Sierra Leone that ended in 2002. But as soon as we started the clinic, we realized that the health system in Kono there was no health system in Kono. The hospital was not fully functional, and there were a few HIV patients, and they were not receiving better care. They're not coming to the hospital, and that is how we switched the clinic from a amputee clinic to a general clinic. And then we started this community health worker program. So we opened the clinic in 2006, and we started the community health worker program in 2008. So in 2 years into the work, we realized that there are a lot of HIV patients, TB patients in Kono. Kono is a diamond mining district, and they work in overcrowded populations, overcrowded environment. So there's the environment for TB to spread. So, and because also it's a metropolitan district, and like there's a mining, there's a lot of prostitution going on, and all those stuff. So there's also a recipe for TB, for HIV, and that is how we started doing TB, HIV in the clinic, and started maternal and child health.
Before we head to the Wellbody clinic, however, let's meet Yabom, an Ebola survivor who was treated at the clinic.
Yabom Kuruma. Mina be survivor.
Who's the survivor?
Ebola survivor.
Okay. So, when Ebola started in Sierra Leone, I was actually back to Sierra Leone to do my thesis research on my master's. I was already studying at Harvard, doing my master's in global health delivery, and then Ebola started. We closed the clinic for a period of 2 weeks where we trained all the staff. So the clinic opened and it's ran throughout the Ebola in the country. Our clinic remained open. It's never closed its door except for those 2 weeks when we did the intensive training. Ebola was spreading like wildfire. They're reporting hundreds of cases a day, and like Port Loko district was the epicenter. Then it was reporting the highest number of cases when we went, and that's why PI started to work in Port Loko district.
Bailor asked Yabom if and what she knew about COVID-19.
I know about and say COVID na bad sick. They can at the world.
I think it is one of the bad pandemics. I say so because it affected the world, the whole world, while Ebola is just a specific region or a few countries.
Now outside church, but the COVID-19 now in church also. So now I make I say now one of the bad pandemic.
You feel say the community gets good understanding
Yes, sir.
for wetin they cause this sickness like Ebola or COVID or other thing. The community, you think they understand better wetin they cause them?
I'm not sure say they understand.
I'm not sure if they understand well, even though they talk, but they don't understand.
I'm not sure say they understand fine one.
Yabom also shared with Bailor her experience of being treated, and he also asked her if she thought there would be value to having more scientific knowledge brought to the country.
Yes.
Why?
Yes, I believe if people have scientific knowledge about infectious diseases, it will reduce the impact that diseases cause. They will know how to prevent themselves.
So you no go kill people there.
Granted, we have a very small sample of people, but so far it would seem that people feel it is a good idea to bring in more scientific knowledge. Going back to the clinic which treated Yabom and multitudes of patients to get Ebola under control, Bailor went to speak with Elizabeth Senessie, the current clinical lead for the Wellbody clinic in Kono.
Hi, Dr. Barrie, how are you?
Good. Can you say your name so that?
Yeah, I'm Elizabeth Kathy, a CHO and the clinical lead for Wellbody in Kono.
Elizabeth spoke to us about what it was like during the Ebola outbreak.
I think for the Ebola, at first, there was no preparation because it was a first and nobody had the idea, especially for some people. Though in the clinical settings, the idea was there, but how to able to handle it, it was a big problem at first. But during the Ebola, so many changes thinking about the IPC stuff. So because of the Ebola, we've learned, because there were so many mistakes that happened during the time of Ebola, because we lost of so many clinicians, nurses, and other healthcare workers.
And then she told us about the COVID-19 pandemic and how it was dealt with.
But because of that, we've already learned. So for the coronavirus, there was a difference.
Basically, COVID came at a time in Sierra Leone when Sierra Leone have learned from the Ebola. So all structures that were supposed to be built for COVID were already in existence in Sierra Leone. They were just dormant because Ebola was finished. So when COVID came, they just activated all of them.
It was interesting to hear Elizabeth's take on COVID, because wouldn't we always want to learn from our past?
So many fears around during the time of COVID, and our response was really great by then, because we've already learned from the Ebola during 2014 because of so many little mistakes that caused a lot of deaths.
Bailor then tried to go in a different direction, probing about the similarities among patients. But he's also trying to dig deeper into another question that would either inform or inspire research.
Does the knowledge that you have about caring for TB or whatever, was it helpful in the case of COVID or
Yes, doctor, because when you think about all these healthcare problems, you know, they have some different kind, but some are like similar signs and symptoms. They present the same.
Yeah, like, do you see any difference? Like, so, for example, our patients with Ebola survivor, are they more prone to COVID or not? Do you see any trend in that?
No, it's not a great trend. No. Because we have Ebola survivors. And during the coronavirus, I think even normal person who have not even been contacted or even they have been diagnosed that particular patient of Ebola before, I think it was a normal thing, doctor. You will not say because this one he or she is a survivor and this one is not.
What Bailor was trying to get to was the interconnection between diseases. This is something that is of particular interest to Nevan Krogan, whom we met earlier, the director of QBI.
So I think there's a great advantage to study multiple diseases at once, especially multiple different infectious diseases. And the way scientists often work is they focus on one disease, be it HIV or TB or dengue or cancer. But what we've found and others have found is there's similarity across these different diseases and similarities across different viruses like HIV and dengue and Zika and different bacterial species like tuberculosis and chlamydia and gonorrhea, for example, that despite being different infectious agents.
Let me quickly intervene to explain what a disease agent is. It is not James Bond, 007, suddenly appearing on the scene. By this, he means an organism that infects the human body. Back to Nevan.
They come in and they attack similar machinery in our cells. And therefore, if you're studying HIV, you're learning about TB. If you're studying Zika, you're learning about chlamydia.
He has largely based his career on making these connections and is often motivated by this specific kind of research.
And I would take it one step further. There's similarities between infectious disease and how disease occurs in our cells and other diseases like cancer and neuropsychiatric and neurodegenerative diseases as well. There are certain pathogens that are known to cause cancer and different neuro disorders. I think what we can be doing as a collaborative community is finding more of those connections, which can ultimately help treat all disease at the end of the day.
Nevan has a lab dedicated to finding connections. We could say that this is his driving force.
The deeper we understand how a disease works, the more effective it will be ultimately to try to treat it. And a point is that as you go across different disease areas, I think we need to realize that they're more connected than we thought. So therefore, understanding one disease is going to inform understanding another disease. So if you think of all disease as connected, which I think it is, if you look at disease in this manner, then I think we're going to be having some very exciting, unanticipated findings that are going to be translated more into novel therapies and novel ways to treat all disease, really.
Bailor's also looking at the need for further research that makes connections between diseases to understand them more deeply.
Clearly, there's a link between TB and HIV because HIV affects the poor immunity, and TB caused poor immunity, and also TB can also affect somebody with a low immunity, and HIV cause low immunity. So they're basically interlinked. The exposure to several other diseases and other bacteria, other diseases that might create some immunity against COVID, which is not proven yet, but there are some theories that are written about it, and it's something that is good to study to understand really why It's still not as bad as Europe and America and other places. So there must be a reason why that needs to be studied.
Dr. Kabba had also broached the topic of needing more information, more research to come to certain conclusions.
With research, we were able to have tangible data and evidence for what we are doing as to what is acceptable and can be applied in a local setting like Sierra Leone. It's not everything that applies in Germany or UK that is also applicable here. So through research, you're able to identify your own unique things and your own unique opportunities you have in managing patients or improving on the healthcare as a whole. So how can I research what is responsible for that? I can just say, okay, it could be that they have a good immunity, they're exposed, but this is my own projection. It's my own speculation, right? It's not scientifically based.
Perhaps one of the long-term outcomes of the event in the distant future will be a full understanding of the impact of one disease upon others. This, among other things, would be a big breakthrough. Which brings us to the why, or the need of having scientists work together on a global scale. Bailor always had a specific reason for wanting to bring the symposium to Sierra Leone.
So I think one reason why I think this symposium is unique and important, I've been to many scientific symposiums, but the addition of these workshops are important because they will build capacity. And the major reason is one, to expose young scientists or students or people that are interested in research to scientists that are coming from different parts of the world, but also to build their capacities. So, for example, Sierra Leone health financing, most of it is by donors, and these donors actually drive the agenda, the health agenda. And that is what I'm really interested in changing. That it doesn't mean that if you're giving us money, you should drive the agenda of what we are doing or what we want to do. We should be able to drive the agenda through evidence. We should be able to get evidence to say this is what we think works for us. And that empowerment is really what I'm interested in getting, so that people can talk to donors. And that's where research is important. Mm-hmm. If we can do a lot of research in the country, design our research and have our results and have our evidence, then we can present. We will not just say this is what we want. We can present an evidence like, okay, we did this research and this is what we think works for us. And so the donor will not be able to argue and say, boy, we did this, it works for us.
So how does Bailor see this symposium? Is this a one-time event to bring people together? Why is it so important to bring a symposium and workshops to Africa?
This symposium is a beginning. It's a first step. Mm-hmm. It's a first step to expose Sierra Leoneans to what is possible, to expose and create relationships and networking. When they do conferences in other parts of the world, sometimes if it's in Europe or in America, to get a visa to come to those places is a limiting factor that eliminates a lot of Africans from coming there. But anyone from South Africa, from anywhere in Africa, will come to Sierra Leone. And even people from Europe and America, it's easier to get a visa to go to Sierra Leone than the other way around. So getting this symposium in Sierra Leone and making sure that this symposium, if we can continue this kind of thing like in Africa, would make it easy for people within Africa to travel to the symposiums and get a lot of networking and interact with a lot of people, a lot of researchers that would be beneficial to them in the future.
Can't people just come to where they're being offered in other places in the world?
Whereas when we're doing you have a HIV conference happening in Germany, how many Sierra Leoneans will have a visa to go to Germany? How many Sierra Leoneans will have how many Ghanaians, other people will have a visa to go to so you're eliminating most of these people. Or when they have the HIV conference in Canada, how many people were eliminated from going there? So it's like bringing it to those places where most of the data is actually coming from is, to me, is something that I'm really interested to see how that will build up. So this is just like planting the seed that can grow to a big thing that I will not imagine about. But like, this is just like showing the world that it's possible to do a scientific research in a country like Sierra Leone.
Nevan, Bailor, Dr. Kabba, the various co-organizers and I were definitely on the same page when it came to the reasons and eventual outcomes desired out of this one-week event covering scientific presentations, workshops, and the site visit. For Nevan, it's a lot about leveraging different strengths in different places and having technology be the scientific glue.
I think the value of the workshops, the value of the symposium in general, I think, is to tell the scientists there, especially the young scientists, is like, you're not that far away from what can be done. And I think one of the messages is like, you can do a lot here. You can use your passion and your intelligence, and the world's becoming much smaller. There's data can be generated very quickly around the world, and I think data is a very powerful way to connect different people, especially now coming with AI and artificial intelligence and machine learning. If we can collectively generate data, which I think we can, then we can analyze the data in different ways. They'll have different ideas in Africa than we'll have here in California, both equally valid.
During the second day of the symposium, there will also be a poster session. It is perhaps important to explain to the general public what a poster session is. It is not really something you see at other conferences. Within the scientific context, there is an area set aside for young scientists to bring posters that outline their current research. It is a very particular method for scientists to communicate what they are working on. The poster itself is usually about 1.5 meters wide by 1 meter. In a sequential manner, there'll be both small paragraphs of text and images. These images are called figures within the community, and they depict the steps and thought processes associated with a specific aspect of research or project in a lab. These poster sessions are usually exciting and full of activity, as people walk from one poster to the next to discuss and ask questions about technical details of a project. This event has awarded travel scholarships to young scientists across Africa who have posters to come and show. There will also be judges voting on the top 3 posters.
But then you also have poster sessions where young scientists come, and it's a way in which they can present their science, and we're going to have a series of judges pick some of the more exciting scientific presentations.
It also gives an opportunity to the visiting speakers to see what the young African scientists are up to and create a new kind of dialogue.
In general, when you have meetings like this, you have the more senior scientists usually speak, and the younger scientists have poster presentations. And it's a format where the more established scientists can interface with the younger scientists and learn from the younger scientists can learn from the older scientists. But it's also a way for the different younger scientists to make connections as well. So it's a mechanism where scientists outside of Sierra Leone and outside of Africa can come in and learn what's going on.
This naturally segues us to capacity building, a term thrown around so easily in the Global South or about the Global South, often invoked as a panacea without a clear prescription. Most likely, any meeting with an international agency or an NGO will have a capacity building component. So why is it that young African scientists are coming from across Africa to attend scientific workshops in Sierra Leone? What does capacity building mean, and what does it mean in the context of this particular meeting? Dr. Kabba had something to say about it.
My thoughts on capacity building is that there's a lot of capacity. I mean, let's start with the word capacity. There's a lot of capacity in these African countries, especially in Sierra Leone. Most of my compatriots, most of the people I interact with are highly intelligent people, hardworking, and Dr. Barrie, cited by you just now, is a glaring example. What is sometimes lacking are some form of exposure to state-of-the-art and improved ways of doing things, communication, and materials to make people enhance themselves and develop the capacity. So capacity building for me is like identifying the capacities that we need to build. It should be deliberate. If we are looking at building capacities in the area of research, what kind of capacity are we looking to build? Is it at a level of people who are going to academia, who wants to become professors, or people who are going to be the technical people working in the laboratories, right? Or people who are going to be doing the field work. So it's like really identifying the gap first of all, and trying to address those gaps in terms of and providing the necessary capacity building mechanisms.
4 workshops, as we mentioned earlier, are being offered after the 2-day symposium, and each is being led by the scientific visitors who came to speak at the conference. To remind you, these workshops are clinical research and study design, grant writing and science presentation, molecular biology, and microbial sequencing bioinformatics.
So you have young students who are interested, or young doctors who are interested in research, but they don't know how, they're not exposed to do research design, okay? Clinical research.
Although Bailor himself is teaching one of the workshops along with another co-organizer and longtime partner, Dan Kelly, he's keen on the skills the grant writing and scientific presentation workshop will be teaching and the specific capacity that it will bring to those who take it.
Another one that is also very important is the grant writing. It's not like the Sierra Leoneans themselves or the Africans themselves coming with a research question and then writing a grant to win a grant to do the research. And so that grant writing would expose them to the methods of writing a grant, so they will also be able to take the bold step to write a grant. They can work with people that they will meet in the scientists that they meet in the research to help them, but they will be the ones that will initiate the grant writing. So if some people are able to do the design the research question or whatever, then they can work with the people that do the grant writing to write a grant. I believe in capacity building into providing credential training for people. Then you build their capacity by that way. You put the environment for them to be able to use the training. Then they can build their capacity. What is really lacking in Africa? What is really the gap that Africans get? I've been in Africa and I've worked in Africa for a long time. There is no opportunity, and I know in many African countries there is no opportunity within their universities to expose students to write grants, except if they want to write grants outside internationally. So if they learn the skills, they'll be able to target some grants. Some people will look at, there's an advert for a grant, but they don't know how to write.
Perhaps everyone has a favorite workshop. Nevan and I will be teaching the grant writing workshop, but he's excited about the bioinformatics workshop. This, of course, makes a lot of sense with his passion for generating data to understand those infectious agents.
I think the bioinformatics workshop is a great tool to help make collaborative connections. There's so much data out there. There's so much data on different diseases that we all have access to. And if we can help the young African scientists with how to analyze and interpret that data with relatively simple computational tools, I think we can help show them that they can do what we can do here, and they'll have different ways of looking at the data compared to how we do it, and connecting individuals that think differently I think is very powerful, and they'll have a very unique kind of view of this data because we're going to be focused on data generated from infectious agents like TB, HIV, Ebola. They're going to have a closer connection to a lot of those infectious agents because they have to deal with them.
To conclude on the capacity building theme at this moment, Dr. Kabba had an inspiring anecdote about the local talent.
I have, for example, a good group here working with us at one of our hospitals. The group is from Holland. They came, they were asking for young people to do research. Now we recommended one guy, one young medical doctor. He's doing fantastic PhD. He's looking at infections and antibiotics, antibiotic resistance, and in surgical wounds, right? So he's really marvelous. They were telling me where did you get this guy from? Because they had no idea, no clue that there could be somebody here who has at least that capacity that can be built on so fast. Just helping people around here, identifying them, and giving them that necessary support, and they can do a lot of great things here locally.
Something very important that is being addressed at the symposium are the issues that African scientists face when trying to publish papers. Dr. Kabba addressed this issue when I spoke to him a few weeks ago. It's a very real challenge across the continent.
It's very difficult for me to really capture this in a moment because there's a lot of conversation and discussion going on around as to access to high-end journals and availability of materials for people to be able to conduct proper data review and review of articles, and have access to articles that people subscribe for usually when you don't have the required resources. So actually, and also publishing in credible journals, in high-end journals, it also goes with some form of financial commitment, which usually is not the case. So it's a whole lot of discussion as to access to materials to make your publishing rich, your documents rich. Also having also the resources to make sure that if you have a rich document, which journal can you send it to based on the cost journals are requesting for in terms of publishing. So it's a conversation around that. How can we have more funds and access so that people can be able to do proper reviews and publish their documents, their research.
Bailor had broached the topic earlier himself when discussing scientific colonialism. There he was referring to the lack of speed in addressing Ebola versus COVID-19, for instance.
And that's also something that I'm also talking about, global health colonialism or whatever. Because Ebola impacted 3 countries, the West African countries, they're not the world, like the pharmaceutical companies, they didn't do like what they did during COVID.
But back to Kabba and publishing. He might not be calling it scientific colonialism, but it is also what he's referring to in regards to publishing.
As to how can African countries have more access to published materials, how can we have also the opportunities to publish in high-end articles and journals without going through undue financial constraints, and also to have that network to support your publication, because we already know that in publications there are certain things that people look for. Some of the people who are in the publishing list, who are the co-authors, can just one name can make a whole lot of difference in terms of that article being accepted to be published. So there are some people who have not yet made their name, but they are presenting good papers. So I think there should be equal opportunity given to everyone who has a very good article to publish.
To address this important topic, the co-organizers managed to secure the very enthusiastic Emma Yee from Cell, one of the 3 most revered scientific journals in the world. She'll be a keynote speaker at the symposium and will specifically address how to write and submit a paper for approval in such a journal. She will also be available to meet with scientists during the week. Importantly, she will also be part of the Lunch and Learn session led by women on the 2nd day of the symposium, which will also look at the various career paths that can be taken in science.
I think it's cool too that our keynote speaker is an editor of a top journal in the United States, Cell. So she's going to be talking about how you publish your work in a top journal. And this is a discussion that's not normally had in a place like Sierra Leone.
Or in Africa.
Or in Africa in general. And I think this will be very enlightening, especially for the younger scientists. I think they're going to learn a lot from this, the editor, and I think they're going to realize, hey, we can actually we can publish in this journal. You know, we can do this. So I think it's going to be particularly insightful for the younger scientists.
As we are coming to the conclusion of our podcast, we ask for some final thoughts regarding the ambitions of the one-week event, symposium, panel discussions, workshops, and the site visit. Bailor spoke about the inception of the idea and the motivation.
We're talking, and then with the idea of like, can we do a scientific conference in Africa, in Sierra Leone? I was like, that would be the first in Sierra Leone. There's never been a big scientific conference in Sierra Leone. What we thought this conference will really bring to Sierra Leone is that it will expose Sierra Leone to the scientific community, because like we're bringing scientists from all around the world, in Africa, in Europe, in America, and there would be the potential for developing some relationship that will be lasting relationship for Sierra Leone for doing scientific research and empowering Sierra Leoneans to be able to do research.
Nevan spoke about potential outcomes.
I think there'll be a number of outcomes of this series of events. One, I hope many collaborations start with scientists from Africa, scientists from Sierra Leone, and scientists around the world. That'll last many, many years, where it'll be mutually beneficial. I hope that we can inspire a number of young scientists in Sierra Leone to think big.
Dr. Kabba talked about a societal shift, or perhaps an enhanced world order when it comes to science.
As a result of this symposium, the kind of change I would like to see is a paradigm shift in the attitudes and perception to research, so that we have a new cohort of young people who don't see research as just an end to it all, but it's a process. It's a process of training, developing capacity, as well as adding value to medical knowledge and education, as well as improving on services that are being provided generally for the population in terms of healthcare. So for us to have institutions that can guide this process and enable us to really attract good grant opportunities and research opportunities that will improve the research landscape in our country.
When I asked what they thought would be the effect of this symposium 25 years from now, Nevan thought there would be a stronger scientific infrastructure in place to allow for a different kind of progress.
I think 25 years from now, there'll be a much stronger scientific infrastructure that exists in Sierra Leone, where there'll be tools, including computational tools and the artificial intelligence space, where African scientists can study the infectious agents that are afflicting, the general population. I think we're coming into an age where medical research is becoming incredibly exciting, and for a variety of reasons, including a lot of breakthroughs in the space of AI. And there's a realization that those studies don't just have to happen in the most developed countries in the world, that breakthroughs are happening all around the world, and there's great young minds in Sierra Leone. So science is a language that's becoming more prevalent around the world, and I think Sierra Leone and other countries in Africa are perfectly situated to build up an infrastructure to leverage those connections and be a major player in the world.
Dr. Kabba laid out a structured thought plan for 25 years from now in the future, a measured but ambitious answer.
I would like to see science doing a lot of things, but this is a very ambitious question, if I think ambitious in the way I do right now. But I don't want to apologize for being ambitious. But in Africa, I think we need to have similar state-of-the-art research institutes and grant opportunities like we have in the Western world. And we have scientists who are at the helm of affairs in our African countries, collecting data and presenting it to the world to help humanity in form of healthcare service delivery. it can, because we have the potential here. Most of the things that need to be researched on now and the raw materials for research in terms of infectious diseases are available locally in country. So you don't need to ship them out. You can just do everything you need to do here, have good institutes to manage the process, and also improve your people through such activities. And of course, research creates the opportunity of developing technology in a way that technology can also help provide service delivery and medication, help the doctors do their work. We can use digital technology to enhance the work we do in our hospitals. And I'm really hopeful that with the new partnerships we are creating and the right mindsets people have in our countries, we'll get there.
And finally, how does the man who started all of this, Bailor, see science in Africa and Sierra Leone 25 years from now?
I studied in Sierra Leone. I lived there and I worked there for so many years. I know what we lacked in Sierra Leone. Sierra Leoneans writing NIH grants or CDC grants or other grants that will come to Sierra Leone and support and build the capacity. Mm-hmm. So I'm hoping that this symposium can open the eyes of this scientists that Sierra Leoneans are strong, they're intelligent, mm-hmm. they can do things. And so that's in my mind, that was playing in my mind when I wanted this symposium to go to Sierra Leone, and so can expose this young medical students, science students in the sciences or whatever, to great researchers, and they can have opportunities. So it's a form of like creating an opportunity for them and creating a platform for them to grow in research and sciences. For example, when I went to school, in high school, we don't even have a lab in the high school. So I think this is also an eye-opener to the country. The idea is for the what we want to do is to change the paradigm of like just say, no, this person is there, I can use him, you can use him to get things done quickly, but to work closely with that person to build that person's capacity.
And also partnership?
And partnerships. It's a 1 week, but it's enough to build relationships. My hope is that in 25 years, not only there will be equity in research, education, conferences, and everything that right now as we're talking is all driven by the West. It's something like the relationship between the global North and the global South would be a relationship of equity, equal opportunities. Not only using like the global South is Africa, right? The global South as being in the menu, but the global South to be people developing the menu and being on the table developing the menu with the global North. The global South to have a clear voice when it comes to like programs, when it comes to like research. So that equity is what I want to see in 25 years from now, that there's a strong voice from the global South, and the global South is on the table.
Thank you for listening to this QBI podcast, made and distributed in collaboration with the University of Sierra Leone and the Ministry of Health of Sierra Leone. This event was made possible by the generous support provided by the following: Gilead Sciences, the Bill and Melinda Gates Foundation, the UCSF School of Pharmacy, the UCSF Center for Pandemic Preparedness and Response, Eli Lilly, Rezo Therapeutics, the National Institute of Allergy and Infectious Diseases at the National Institute of Health in the USA, the HIV Accessory and Regulator Complexes Initiative, the QBI Coronavirus Research Group, the Host Pathogen Mapping Initiative, Novartis, the UCSF School of Medicine, Partners in Health, and QB3.